There is 3 different types of estrogens that are present in a woman. One is called the estrone, which is E1, and then there is estradiol, which is E2, and then there is estriol, which is E3. So the most abundant of the 3 is estradiol, and it's the most important of the 3 and most potent of the 3. But as a person, and the estriol is produced during pregnancy. Mostly a lot of it is produced during pregnancy, and it is the most, the mildest version of the estrogen, and it is the safest. And so as a woman is younger, she has more estradiol and not too much of the other 2. When they get pregnant, they have more estriol. But as they get older, they are actually making the 3rd hormone more, which is the E1, and it's called estrone. And that's why the incidence of breast cancer and all the female cancers are more, or increased incidence of those as you get approach menopause and you're post-menopause. So 50 years and older, you are at a higher risk. And the reason for that is because the metabolism of the estrogens has changed as a person is getting older. So they are producing more estrone, which is carcinogenic, which means they are linked to breast cancer and even fibroids, or even any kind of tumors. You know, you have uterine cancer, or you have cervical, not so much cervical cancer, but uterine cancer, ovarian cancer. The estrone is connected with that. So it's pro-carcinogenic. This is what we call it. But when a woman is younger, she doesn't have that much of that. This is why there's not that high incidence of breast cancer when your woman is younger. But when they get older, their metabolism changes. So when we do bioidentical hormone replacement therapy, we are not using estrone at all. So that's E1. We do not replace estrone. But because the woman is older, her metabolism may have shifted already. So when we do the bioidentical hormones, we are also watching for the conversion of estradiol, which is E2, into E1, because that's what's naturally would be occurring as a woman is older than 50. So when we are monitoring the hormones, it's not just enough to take the hormone. It's also very important to monitor the metabolism of the estrogen in your body. So the key factor of monitoring the hormones is to check the conversion of the estradiol into estrone. And that's why we recommend the annual screening. So even if you walk in with the higher incidence or higher risk of getting a breast cancer, because naturally you're older than 50 and so you have more conversion of estradiol into estrone, then you can detect that. When you walk in and you start doing the testing, we find out, okay, great, so your metabolism is shifted over more to estrone, and we can switch it back to more to estradiol and to estriol, which is the safest of the 3 hormones, naturally. So we can actually give you supplements that will change that conversion. So if you were to walk in and get a bioidentical hormone replacement therapy with any doctor who's well versed with it, then your chances of getting your risk of getting breast cancer or ovarian cancer is actually reduced, because you are being screened already, which is more sensitive because it's biochemical reaction. You cannot check that on mammogram, because mammogram is a physical thing. So if you already have a bigger size tumor, that's what's going to be detected with mammogram. But we are looking at biochemical changes of the hormones, and the test that we recommend is a 24-hour urine test, where we can tell you what the conversion rate is. And that is very, very beneficial. Even if you don't do any bioidentical hormone replacement, it's a good idea to check your conversion, so then you can reduce your risk for breast cancer.